Good afternoon, everyone. It's nice to see you all. Welcome to our Friday JF meeting. We will begin with remarks from our chairs and ranking members. Senator Anwar.
Thank you. Good afternoon, everyone. Thank you for everyone who's here, especially all the families and community members who are here for support of the bills that they're passionate about. We appreciate you being here. Thank you. And hoping to have a productive afternoon. Madam Co-Chair, back to you.
Thank you very much, Senator. Representative Clara DeStitria.
Thank you, Madam Chair. Welcome, everybody.
Thank you, Representative. As we say before every meeting and hearing, there are multiple meetings happening throughout the building. So all of us, both in leadership and as members of the committee, are in multiple places. So we will be leaving votes open. The time will be determined as we get farther in our meeting, but we will have votes open today. So we ready to get started? All right, great. We are moving on to bills to be considered for JF action. Item number 1 is Senate Bill number 1285. This is an act establishing an overdose prevention center pilot program. This is a JFS to the floor LCO 6772. May I have a motion?
So moved.
Moved by Senator Anwar and seconded by Representative Jenga. The bill before us today will allow the Department of Mental Health and Addiction Services and DPH Public Health to create an overdose prevention pilot program in 4 Connecticut municipalities, subject to the approval of the chief elected official. It will allow for the establishment of an advisory committee chaired by the Demas Commissioner that shall provide recommendations on things like professional licensing, liability, and the availability of recovery resources and more. It will allow the Department of Mental Health and Addiction Services to create regulations and requires a report back to this committee. It clarifies that no state funds are to be used for the pilot, but that Demas may accept grants, donations, material from outside sources for use in the implementation and operation. And it specifies that a CON, a certificate of need, is not required for said pilot. The S language moves this from shall language to may create, and specific language was added regarding not utilizing state funds. And I realize I'm going to turn it over now actually to Senator Anwar.
Thank you so much, Madam Co-Chair. Thank you for the brief explanation of the bill. I'll speak a little bit more about why this is necessary. We are very late for passing this bill. We're very late for 1,100 people in 2024 to pass this bill. We are very late for 1,200 people in 2023 for passing this bill. We are very late for the 1,350 some people in 2023, I believe, and it was 1,500 plus in 2022. That was the peak. And every single one of these deaths were preventable. Every single one. And this is how a failure of a system manifests itself. I know there are many parents in the room today who have lost their loved ones, and I know many parents who could not be here. They are listening to our conversation at this time. It's important to know that we have to look at a public health lens when we are in the Public Health Committee. If we are in Transportation Committee, you look at it from a transportation lens. If you're in the Judiciary Committee, you look at things from a judiciary lens. But if you're in the Public Health Committee, then you have to look at the issues from a public health lens. So I wanted to set the understanding of why this is necessary. This has data for about 40 years. And if somebody's going to say that there's not enough data, well, I would like to know, is it 60-year data we're looking for? 40-year data is not enough, because for other things that we do around this space in this building, we do things with the understanding that there is scientific proof of this. So I just wanted to touch on a few of the aspects, and I'll touch on this briefly. As you had heard in the testimonies, there are more people dying in the state of Connecticut from overdose than from motor vehicle accidents. And if you look at the number of deaths per capita, if you look at the entire country, Connecticut has twice as many deaths with overdose than the rest of the country per person, per capita, and then the population perspective. It should be unacceptable. And that's why I say that we are so late, because other states are moving forward. And Connecticut, which has far higher death rate, is still behind, and we are arguing about some aspects to the point that we have to dilute the bill to make sure that we do whatever we can to save the lives, and then not give reasons for people to not say yes to this important bill. There are over 200 plus OPCs around the world. And of those, the number of deaths at the OPCs is 0. So, and this is worthy to know that for the 200 OPCs in the entire world, the death rate for them is 0. And we have, by the end of the day here in Connecticut, 3 people will die. So this is what failure of policy looks like. We have improved in our policies because of a number of people sitting around this circle who have voted to get Narcan accessibility, and that's why we are down from 1,500 down to 1,100. So that's important to recognize that as well. There's been study to prove 35% reduction in overdose deaths after the opening of the North America's first medically supervised safe injection facility. A French study had shown that 67% decrease in overdoses over 6 months, just right after it was started. And this is something that not only reduces death, but the risk of HIV infection, hepatitis infections. You name the type of infections that are spread through IV drug use, they are decreased as well. And that's something I want us to understand. You probably heard the lawyers and the attorney who had spoken about this, that why this is necessary. And I want to put this in the right understanding. The historical law that people may use from the federal law, which is 21 USC 856, it does not apply to the OPCs. Because we are the bill is about the places that are promoting the use, and this bill is about preventing deaths. Very clear difference. This is about a public health space. This is about a public health mission, giving a lifeline to individuals. It is not a criminal enterprise. There's a difference in that as well. There are harm reduction justification that have been proven time and again around this aspect. The legislative intent is about getting the people to survive. And once they survive, we are able to have them to go through rehabilitation. That's also proven that it's very simple. We don't have to have a study to prove that dead people do not have rehabilitation. But in case people want to know the survivors, if they go for rehabilitation, the answer to that is yes, they do. And they get better. And the other thing is the crack house law violates a due process clause. So it itself is a law which is not a law which is applicable. And the doctrine of prosecutional discussion and public interest also is important to look at it as well. So the crack house law does not apply to this. This is a public health issue. This is a public health disaster we are dealing with. If people have any confusion that it's not a public health disaster, talk to the families in your district, because the data even in Connecticut shows that almost half the people know somebody personally in the state who have lost their life to this. So I would urge people to, in their conversation, be kind, understanding, and you vote your conscience. And I want to stop here, Madam Co-Chair. Thank you.
Thank you very much, Senator Anwar. Thank you for your passion, and my thanks as well to all of the advocates who have come before us, as well as the committee, for continuing to engage in a robust conversation with all of us sharing the goal of making sure that we are saving as many lives as possible. Representative Clara DeStitria.
Thank you, Madam Chair. I do appreciate the intent of this bill, and I think we all agree that we do have an opioid epidemic. But I think we also agree that at the end of the day, we want to, one, save lives, yes, and we want to help people recover from their addiction. I don't think anybody goes into this saying, I want to be addicted for the rest of my life. I think they go in using drugs to try and to fill a need or fix something that they're suffering. And then it ends up being a lifelong drug dependent issue that hopefully they don't succumb to. I really feel that we need to do whatever we can to help people get into rehab and then get off drugs and then get back to, I use the quote, air quotes, normal life. And enjoy the things that they probably once were able to enjoy. I do have some concerns about this bill. The federal issue is one of them, but one of my concerns, and Madam Chair, I don't know if you can answer this now, in lines like 13 or Senator 13 through 16, can you give us a little bit more detail if possible on how these injection sites specifically will work within the facilities? Like how big will they be? Will it be in the back corner of a facility? Will people see it the second they walk in? Will they be away from other people in the facility? And is there an age limit to the resident that will be able to access these facilities?
Thank you very much. I'll start and then turn it over to my good co-chair. So the language in lines 13 to 16 doesn't specify with some of those size and specifics on the location, other than to say it would be a separate location. And in terms of age limit, there is not a specific age limit to the bill. I will turn it over to Senator Anwar, as I know he's had the opportunity to actually visit. I'm still hoping that some more of us from the committee will have the opportunity to visit some of the centers, but seeing as I have not, I will turn it over to Senator Anwar.
Thank you so much, Madam Co-Chair, and thank you for our ranking member for the very valid question. We have purposefully left some of the information. This is a bill that is inspired by the work that has been done in Rhode Island. And how Rhode Island was able to address this was that they actually had a team of experts that came together, and they will be able to help us. They will be part of this group that will come with the guidance from DMIS and DPH to be able to help write the regulations. The reason is that the existing regulation, they're publicly available. Even the Rhode Island regulations are publicly available. The regulations that New York has are publicly available as well. And Rhode Island is already, from January till now, they have saved hundreds of lives, and they're able to prove how many benefits the community has been able to achieve just from that one site at this point. I want you to know that the specifics of this are going to be put through a regulation, through a committee that is going to have a meeting on the regulatory process. And a number of other questions around the specifics are going to be through the regulatory process. That's the way to do this in an efficient and effective manner with the group of experts around the table. Back to you, Madam Chair.
Thank you, Representative.
Thank you, Madam Chair, and thank you, Mr. Chair, for those explanations. You had mentioned that Rhode Island was able to save many lives, and you said there's data to support that. But that goes to my next part of that question. With those lives that were saved, how many people now moved on to rehab? And I think that's a question that we've been asking through this whole process this year and last year, and even in the public hearings. We want to know, yes, no one's dying in these facilities, which is wonderful, but how many people are going through rehab and getting off these drugs forever, hopefully?
Senator Anwar.
Thank you, Madam Chair. So they've had it for not even 3 months yet. So, but I can tell you what the data for other places have shown is the rehab is used 30 to 60%, depending on the centers. So the rehab use does increase, and that's and many of the people who testified have spoken about that too, and many of the experts, world's experts, have spoken about this as well. So the rehabilitation likelihood increases by 30 to 60%. And Rhode Island data, it's been a few months, so we have not been able to get that specific data from Rhode Island yet. Thank you.
Thank you, Mr. Chair. I would add that I think it's important, and my understanding from the testimony that we've heard and the data that we've seen is that increase, as Senator Anwar said. So as opposed to some of the other places and ways that people are attempting to go through rehabilitation or in recovery, that there's actually been some increase, which is important. But I do think that it will be helpful to gather information with Rhode Island being our neighboring state and so close by and having a lot of similarities to us as Connecticut. It will be helpful for us.
Thank you,
Right.
Madam Chair. And I don't know about anybody else, my fellow colleagues, but I think that was a question that was asked multiple times during the public hearing testimony. What percentage of people that utilize the overdose protection facilities moved on to rehab? And we were never able to get any data from anywhere, from even if it was from this country or out of the country. And I think if we can get that data, if someone has it, we would love to see it. So this 30 to 60% is wonderful. But again, this is the first time I'm hearing it, and I was here through the entire public hearing testimony, but I appreciate the answers to all my questions. Thank you, Madam Chair.
Thank you very much, Representative Zupkis.
Thank you, Madam Chair. And I just want to start by saying if there is any family member or friend that has lost someone to drugs, I am so sorry. I know people that have been lost to drugs, and it is devastating. So if you're here and have had experienced that, I am so sorry. I too sat through that whole hearing and never heard that information as well. So as my good ranking member said, if those statistics or data is available, I would appreciate that also. Could you, Madam Chair or Mr. Chair, talk a little bit about the CON process? I know, Mr. Chair, you and I have had many conversations about CON regarding hospitals and what they're going through now. I know there was something, I believe it passed out of this committee that skirted around the CON process. And as I understand it, in this bill, there is no CNM process. And if people in these safe injection sites, which is what they're called, but now it's changed. I think I was on a call and they didn't want to call them that because that would put people in a panic a little bit, are dealing with controlled substances. I would like to understand why there is no CON process.
Thank you. I'm happy to again turn it over to Senator Anwar. And you are correct. The bill does not require a CON process, and happy to turn it over to you, Senator Anwar.
Thank you so much, Madam Co-Chair. Thank you for the question. So this is not a for-profit entity. This is a entity that is being used only to provide care, and there are multiple different titles that have been used. And in the area where people are looking at it, because of the research that is coming out, they want to try to use a standardized terminology, and that's why Overdose Prevention Center is what the people in the research arena have looked at, and that's why they're using the OPC as the title for it. So there are various other names that have been used in the past, and I understand as I learn more that OPCs or Overdose Prevention Center is likely going to be a more commonly used terminology for this. The reason for the CON is that the purpose is very focused. It's a specific area. There is nobody providing this care at this point, and it's also not for profit. It's actually just people saving life. It's basically Good Samaritans on steroids. And if somebody was on the road or right in this room, if somebody passed out, each and every one of us in this room are going to try to help out, and then we're going to call for help. And right now, what we are saying is that these individuals who are unfortunately having effects of the substances that they're using in the dark alleys and the corners or in restrooms of fast food restaurants, we are just saying that we are all going to be a collective Good Samaritans on steroids and then allowed to be able to take care of them in one place. And that's why in the same way, we do not need a CON in this situation, and we are clarifying that in this bill. Thank you.
Thank you, Mr. Chair. I believe there is a nonprofit hospital, and they are nonprofit and require a CON. So I I thank you for your answer. I don't necessarily agree. I think if there are places that are saving lives, being good Samaritans, but using drugs, they should go through a CON process. So, but I appreciate your comment. Um, Also, could you talk to me a little bit about, um, we know that federally heroin exists, is not legal. We know marijuana is not legal. It is legal in Connecticut. I understand that, but is this ultimately legalizing heroin because you are able to use it in these places through you, Madam Chair?
Thank you very much. And Representative, I'd just like to go back, if I may, to the CON conversation for just a moment. One of the aspects of our CON process is looking at access, quality, and cost of care. We know that we don't have access to this in the state. We know from a cost standpoint, in terms of impacts to the system, we are not using state or federal dollars. And so in those respects, I know that doesn't fully answer your question, but I just did want to remark on that. But in terms of your question, no, this does not make heroin legal. What this does is allow people who are using illegal substances to do so in a safe, supervised environment so that they can survive, and in the hopes that we can help provide services and help them to move on to treatment. But no, it does not make that substance use legal.
So thank you for your answer. It doesn't make it legal, but we're allowing people to use illegal drugs in these places.
What I would say is we are allowing people to assure their survival so that they can recover. That is what we're doing.
Thank you. I appreciate your answer. I would disagree, but I appreciate it. And I know someone very dear to me that was on drugs. And if this would have been available for them, they would have probably never gotten off of drugs. And so, as my good ranking member spoke about trying to get people off of drugs, I remember when in this public hearing, I specifically asked the question to somebody if they try to help people get off drugs. And the answer was, no, we want them to be happy. And while I understand we want people to be safe, I want people to be happy, but I want people to be able to get back to their families, their parents, their children, their friends. And what bothers me about this is that this doesn't do it. This does not help people get off drugs. May give them a safe place instead of going behind a dumpster, which I know people that have gone behind dumpsters and been found alive and survived, but I know it doesn't happen to all. So I really struggle with this. And I guess what I struggle with mostly is hearing people tell me that I don't have compassion because I don't vote for this bill. That is so insulting and quite honestly infuriating to me, because I want people off drugs. I want people to have a happy and healthy life. And to say because someone doesn't support this or meet them where they are, I have more compassion probably than a lot of people and have empathy. And that is infuriating to me. Thank you, Madam Chair.
Thank you very much, Representative. What I will say about this and so many other conversations that we have here in our hearing, none of us can know what is in each other's hearts. And I think that I have said this many times here around this table. We all, and I know I can speak for every member of this committee when I say that we all want to save as many lives as we possibly can. We may disagree about how to get there. And to your point, Representative, there was conversation during the hearing when we heard from some of those who work in the recovery community who spoke to their work as trying to meet people where they were and recognizing that in recovery, there are people who are in pre-contemplation, thinking about recovery. There are people who are actively in recovery. There are people who have gone through recovery and relapsed and come back, and people are in all different places on that journey. I think that the most important aspect of this conversation for me is that what we all do want is we want people to, as I say to the Girl Scouts and to the kids who come visit us, to be the youest you are, which is to be happy, healthy, and thrive. And in order for us to be able to provide the opportunity for recovery and treatment, someone has to be alive. And this is one way that many of us believe would help more people stay alive so that we can get more people into treatment and recovery. But again, I just can't emphasize enough that all of us here want to do what we all believe that we can do to help save lives. I need to switch over online. Forgive me. Okay. Are there other questions? Comments? Representative Kennedy.
Thank you, Madam Chair. I wasn't actually sure if I was going to speak on this, but looking at the date and seeing all your faces out there, today's March, 21st, 2 days from now, 8 years ago, I had a family member less than 24 hours out of rehab that died of a fentanyl overdose. I'm not sure if this bill would have helped if we had had it back then. She was barely 30 years old. She got addicted in high school. She had an incredible career ahead of her. Unfortunately, she blew out her knee. And this goes back to 2017, 16. She was given a tremendous amount of painkillers. And unfortunately, she got addicted to those and continued. And I bring it up only because regardless of how I vote, I can feel your pain, but I want to make sure we do this. I just wish she could still be here, and that's not going to be. But I just, like I said, I looked at my calendar and realized it was 8 years ago on Sunday. So this is very emotional. It's an emotional vote, and I just don't want you to look at us as someone different, but it's been a lot. And I just wanted to bring that out and thank all of you for being here today. Thank you so much, Madam Chair.
Thank you for sharing that, Representative Kennedy. As I tell my children, often most of life is a math problem. And Rep. Kennedy, thank you for sharing and proving my corny thing that I say to my kids, that statistically speaking, around this circle, most of us have had a family member or a friend or neighbor who has been impacted by this awful epidemic. So I'm sorry for your loss and for the loss of all of our friends, family members, neighbors. Are there other comments or questions? Representative Paletta.
Thank you, Madam Chair. Very briefly, do we have the data, and apologize if this has already been stated, of other states that have done this? Do we know how many states have done this and whether or not it's worked?
I will turn it over to Senator Anwar. The two states that I tend to reference the most are our neighbors in New York and in Rhode Island. We know that these centers have been used throughout the world, more commonly in other places in the world, but I know Senator Anwar has a little bit more information. I think, okay, he's given me the go ahead. So hopefully that answers your question, Representative.
Thank you. And I'll just end with a brief comment. I think that when we're talking about opioids, particularly fentanyl, this has become a nationwide problem. And I think that most of us agree that these drugs make their way into this country many times through our southern border previously. And it's very unfortunate that we have to even take up a bill like this and discuss this. We saw inaction for a long time from our federal government. And to me, I blame a lot of what happened over the last several years on inaction, a gridlock system, a problem that continues to persist. And yet everyone says they want to do something about it, but no one does anything about it. And we have people here that were adversely impacted We have people all over our country in the state of Connecticut that were adversely impacted. And yet we continue, hopefully not for long, to see this impact families. I know of someone that was impacted by this, as you said, Madam Chair, and you are right. Everyone knows of someone that was impacted by this. But I blame the politicians and the people that lack the courage to realize the root of the problem and where these drugs come from. And they said for a long time they would do something, and they did nothing. And that's unfortunate. Thank you.
Thank you, Representative. I certainly think that we all share some level of rage and frustration. I think often of the substances that came from a company right here in our own state. But I think today we are focused on solutions. And this is one. I think there are many solutions. This committee, prior to my being a member of this committee, has done a lot of really important work to help make sure that we have access to every tool to fight it. So I focus here on what we can do in public health today. And this is one of those things. Senator Marks.
Thank you, Madam Chair. I just quickly, during the testimony, it was so moving, and it was so many professionals that work in this industry every single day. And this is what they're telling us is what they need and what really works. And we all have another job out there, right? And I think we all know how frustrating it is when we know what works in our professions, yet others don't listen to us. So I am so thrilled that we're voting for this in public health. I'm so appreciative of the chairs and how hard they've worked on this for many years now. I am feeling very optimistic, and I just hope that next year we can talk about how many lives we've saved in Connecticut. And that will be such a wonderful statistic and piece of data that we can share with everybody. So thank you so much. I'm so looking so forward to voting yes on this bill.
Thank you, Senator Marks. Representative Gilchrist.
Thank you, Madam Chair. I just want to speak also in favor of this legislation and thank the chairs for bringing this to us. As you said, there are many solutions, and this is one more solution in our toolbox. I think there's still quite a bit of stigma and misunderstanding when it comes to addiction in this state and in this country. And one piece in particular that I think the overdose prevention centers, of which the model has been around since 1986, and there's more than 200 sites globally. I think one of the major pieces it does is it recognizes that for many folks, it comes down to them needing to be ready. As much as their family might want them to get the help they need, or as much as they might be experiencing negative consequences from their addiction, they really need to be ready to seek that recovery. And so having a safe place where they know they can go to and get the support they need when they're ready, it's there for them. So thank you for bringing this to us, and I look forward to voting in favor.
Thank you, Representative Gilchrist. Any further comments or questions? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Representative Belton, I did not see you on screen, please.
Belton votes yes.
Thank you. Senator Marks,
Marks votes yes.
thank you. Senator McCrory, Senator Summers, Representative Clarice Dietrich,
Democracy in action, I guess.
Clarice Dietrich, no.
Representative Berger Givallo,
Berger votes yes.
Representative Biggins, Representative Carpino,
It was being voted on. Now I'm curious. I'm trying to look it up.
Senator Slapp, if you could kindly.
Representative Carpino,
Madam Administrator,
Yes,
Madam
ma'am.
Administrator, did you hear my vote?
No, I didn't. I'm sorry.
Carpino votes no.
Thank you. Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Senator Harkadel, Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow, Representative Martinez, Representative Martinez, Representative Moran Bello,
Lauren Bello votes yes.
Representative Parker, Representative Paletta,
Paletta votes no.
Senator Rahman,
Yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp.
Senator Slapp votes yes.
I did not see you on screen, sir.
Senator Slapp votes yes.
Thank you.
Thank you.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
No.
Senator McCrory, Senator Summers, Representative Biggins, Representative Elliott, Senator Harkadel, Senator Kushner, Representative Morrow, Representative Martinez, Representative Parker. Thank you, Madam Chair.
Thank you very much. And we will plan to leave votes open till 4:30. If we get later on, we'll move that back. But for this first announcement, the votes will be held open today until 4:30. So with that, we are going to go on to item number 2 on our agenda. Senate Bill number 1331. This is an act concerning the exclusion of patient health information and opt-in and opt-out procedures relating to the statewide health information exchange. This is a JFS to the floor, LCO 6745. May I have a motion? Moved by Representative Gilchrist. Is there a second? Seconded by Representative Moran Bello. This bill actually asks the Office of Health Strategy to further study whether to include certain patient information and medical records from the health, to exclude, that's what I meant to say, from the Health Information Exchange, otherwise known as CONI, and examine the patient opt-in and opt-out procedures. I will note that the committee leadership has met with the Office of Health Strategy regarding this bill and discussed the need for more granularity and timeliness regarding opting out, as well as communication of consent to patients. We have looked at some alternate language, but not collectively as the chairs and ranking members. So that is not reflected in today's change, which simply, S language simply eliminates the specific reference to plastic surgery. There were also, I will note, there were many pieces of testimony with recommendations from the working group that we had passed last year in 24-19. And some of those in testimony are interested in us actually moving forward with some of those recommendations. So with that, is there discussion? In other words, this is a work in progress. That's what I'm trying to say. And is there discussion? Senator Gordon.
Thank you, Madam Chair. I'll be brief. I understand that this is a work in progress. It continues to amaze me in general why the state of Connecticut is spending huge sums of money on Connie, which could be spent for other things such as better funding special education in our towns and cities, when we've had for years a private health information exchange connected to multiple states that uses no taxpayer money or state or federal money whatsoever. So I just want to make that general statement that I understand this is a work in progress, but I think we really should be relooking at where we are with Connie, why we're continuing to invest money into it, and why would we do that when we have other pressing needs, when there's already a fully functional HIE. And I know that for a fact because I helped found that HIE a number of years ago. So I just want to raise that out there as we're continuing to do these working groups and spend a lot of time trying to deal with Connie. I would think that if we would be able to get Connie fixed, we would have done it long ago. I'm not blaming people involved. I just see this as an ongoing, never-ending process that at some point we should cut the cord and be done with it. Thank you.
Thank you, Senator. Representative Carpino.
Thank you, ma'am. I will support this today, and this may not be a popular opinion, but as this bill moves forward, I would love folks to consider giving individuals true control over their data and being able to opt out of providing any of their health insurance, any of their health information to the state of Connecticut. I recognize that in particular circumstances, whether it is communicable or something else, but I think we should look at giving folks a little more control.
Thank you very much. I think that's in line with some of the conversation we had. About 7,000 Connecticut residents have opted out of the data, and the conversation that we had was with respect to providing clarity for residents so that they understand, and also that granularity and timeliness to improve that. So in line with what you're saying, Representative.
Thank you, ma'am. And I actually took advantage of that option, but don't think it is very well advertised for others. So thank you for considering that.
Thank you very much. Representative Claridis Tetra.
Thank you, Madam Chair. I'd like to make a motion to start a consent calendar.
Thank you. We have a motion to start a consent calendar. Is there a second for that consent calendar? Did I hear? Oh, Representative Kennedy. I think there were a lot of seconds there. So a motion has been made by Representative Claridis Tetra and seconded by Representative Kennedy to begin a consent calendar. Representative Claridis Tetra.
Thank you, Madam Chair. With that said, I'd like to add this item to the consent calendar.
Thank you, Representative. Without objection, item number 2, Senate Bill 1331 will be added to our consent calendar. Moving on to item number 3 on the agenda. This is Senate Bill number 1395. This is an act establishing licensure for long-term acute care hospitals and requiring the Department of Public Health to study the designation of long-term care facilities and chronic disease hospitals. This is a JF to the floor. May I have a motion? Moved by Representative Gilchrist. Is there a second? Seconded by Representative Morin-Bello. This adds long-term acute care hospital to the definition of institution and defines them as they are defined in federal code. It also requires the DPH commissioner to study the regulatory framework of long-term care acute hospitals. And we've heard specifically from one hospital in the state who is interested in, again, being in line and consistent with those federal definitions. Are there questions or items of discussion? Representative Claridis Tetra.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Thank you, Representative. Seeing and hearing no objection, item number 3, Senate Bill number 1395 will be added to our consent calendar. Moving on to item number 4 on our agenda, Senate Bill number 1450. This is an act concerning recruitment and retention of the healthcare workforce. This is a JFS to the floor, LCO 6770. May I have a motion? Moved by Representative Gilchrist. Is there a second? Seconded by Representative Morin-Bello. This bill, which certainly will be another one of our works in progress bills, but currently requires the Department of Public Health to establish a loan reimbursement program for full-time healthcare providers with a certain percentage allocated to primary care providers, those in rural healthcare, and those working in federally qualified healthcare centers. Section 2 allows state-administered student loan reimbursement programs to apply to providers working in for-profit settings. Section 3 creates a pilot program for the virtual education of EMTs and nurses' aides. I'll talk about the S language for that in a moment. We did make some changes there. Section 4 requires the inclusion of radiologic technologists, nuclear medicine techs, and respiratory therapists in the Office of Workforce Strategy and State Department of Education plans that would promote career day presentations, job shadowing opportunities, and partnerships in education about those professions. We heard from them through our work group and the shortage areas that we have. Section 5, which is an addition in the S language, is specific to athletic trainers. We also, actually, that working group literally met today, as well as continuing to meet. This is one aspect, again, maybe a work in progress for us to have the Department of Public Health create a grant program to recruit athletic trainers that would allow for recruiting of athletic trainers to work in rural areas of the state. So just a couple notes about the S language. Section 1 removes the DPH ability to accept grants, donation of funds from outside. This is duplicative language, according to the department, so we remove that. In Section 2, we added physician assistants regarding the state administered loan reimbursement programs in the for-profit aspect. In Section 3, with that pilot program for the virtual education, we've made clear that this does not eliminate the need for in-person training and supervision that is required. So we clarified that in language. And this also removes the original Section 4, which was with respect to the smoke detectors. So with that, is there discussion, questions or discussions? Representative Zupkis.
Thank you, Madam Chair. In Section 1, it talks about the reimbursement, and I sit on education, and we have a teacher shortage. There are shortages in the healthcare industry, and there's a lot of talk about reimbursement to kind of work on and fix these areas. Is there a known cost of what this will be?
Thank you, Representative Zupkis. That's a great question. And in fact, the simple answer is no, but I will add a few notes. We have, to your point, shortage areas in so many places. Obviously, in public health, our primary focus is on those healthcare provider areas, and that's what we have focused on. But I may have said this here in other on other occasions that I'm interested in us talking with members of other committees, for example, Commerce, Higher Ed, Education, and Appropriations, to look at a broader sense. And I know the Appropriations Committee is in fact looking at a study of the programs that are available so that we can look in a comprehensive way. In testimony on this bill, we had testimony from the CCIC with respect to the Roberta Willis Scholarship Fund and funding of that. So the short answer is no. The longer answer is, I think we will need to have further conversation. The bottom line is, across all of the working groups that we had, what we heard clearly from so many was the issue of student loan debt and the cost of education. That was it was a huge theme everywhere. And in fact, will be a theme as we talk later about private equity too, interestingly enough, the impact of student loan debt on the recruitment of physicians and those who are unable to then purchase those practices because of that debt.
Thank you. I think to your point, I think the conversation needs to be not what we can give people for free, but why are colleges so expensive? So I would encourage to go down that road to see, why is college so expensive? And, you know, in education and reimbursement programs, I believe nothing in life is free except my love for my children. Somebody has to pay. And I believe that people need a little skin in the game. And so what is kind of the teeth in this to ensure that if somebody gets this for free, what do they have to give back? What is their commitment to giving back to the system?
Thank you very much. The only real specifics that we have, and I think, as I said at the outset, this bill, like many others, will be a work in progress, but the only specifics are that the awards would be, at least 20% of the awards would be full-time providers who are working in rural communities in the state or federally qualified health centers in the state. We also have a 20% allocation for primary care, but that doesn't have anything specific. So those two areas where there's more specificity are the FQHCs and rural settings.
So they have to stay employed to get reimbursement through that.
Yes, it's full-time. This specifies full-time employment.
Okay. Well, I mean, I think there are some good things in this bill. I do like the intention of looking at retaining and recruiting, is what we call it in education, retaining and recruiting whomever there is in these shortages. I am a no to flag it today. Because I do want some more details on that specifically part of it. And as you said, there's some work to be done. So I hope it does get into a place that I can support it. Thank you, Madam Chair.
Thank you very much. I look forward to future conversation on this. Senator Gordon.
Thank you, Madam Chair. This is certainly one of the bills that is near and dear to me, having been working in healthcare for, I think this is my 36th year now. Hopefully I'll have more years to go. And I submitted a couple of bills on this. And one of my bills I submitted was modeled under what our colleagues in Massachusetts do, where they do say they do have various defined geographic regions. I know we have that here with regards to where there are workforce shortages, rural settings, things like that, and do very much require that if you're going to get a forgiveness of part or all of your loan, depending upon what you qualify for, then you have to commit to a certain number of years. And just not, oh, I want to work in a, an overcrowded specialty in a big city. It's more where there really is the defined need. And if you decide later on that, I'm supposed to commit 4 years and I'm only going to work 2, well, then there's a consequence to that. And it's all, they have, I think, a very nice program. And I modeled one of my bills, or tried to, on that. I think doing what we can for workforce development in healthcare is part of a broader theme, and just not for physicians, for nurses, but there's a lot of different healthcare professionals that we know are in short supply, but try to target that for where in the state there is that need. There's a huge need for primary care and family practice, a huge need for behavioral health, huge need for mental health. We know those types of things, but really see what we can do with an investment. Most of the programs that have been out there do show that when people come out of their training and take advantage of this, they tend to then set roots where they are, unless for some reason they feel they've made a terrible decision and then they're quickly out. And also there are provisions, Massachusetts has this, for example, where you can't double dip. So if you're getting something from the National Health Service or from the military, and you have commitments for them, you can't take advantage of another program and collect double. And those are provisions we should be careful of. I'm not saying that people, do that all the time, but there are clear rules when you have these various commitments. So I understand this is something that we can continue to work on. I think what we can do more and more in the healthcare profession, which is a broad category, would be helpful, especially since in this state, we do a phenomenal job training people, but a lot of people then leave and go elsewhere. And there's many reasons for that. There's high cost of living in this state, for example, high cost of running a practice. I used to work in private practice. I understand that very well. So I think this is part of what we can do, but it's not the be all and end all. Some of this also, could potentially leverage federal money. I've had discussions with DPH, but we don't know the status of some of that. But still, there are efforts out there to see what you can do with various matches and things like that. So I'm certainly happy to see a bill like this, and I would love to see us move forward and see what we can do with it. but also being mindful that every year we're going to have to take a look to see where are we with regards to funding to continue to make this happen. Because it is very expensive if you're going to go to college and go to medical school. Back in the day, my loans were 10 to 12% interest at the time. Fortunately, we don't see those much anymore. But still, there's huge amounts out there. And folks who are coming out of their training are really going to gravitate to where they can make the money to try to pay off their loans as much as they can. So I think this is could be a big win for the state of Connecticut. Thank you.
Thank you, Senator. You raise important points. Then this is one of the reasons why we have targeted primary care, because our primary care docs are not necessarily earning at the same level as some of our specialty doctors, and that is an issue with student loan. I also appreciate you raising the point about those federal funds, and committee members may recall that in the DPH revisions bill, we actually put back in provisions that we had, I think, inadvertently repealed that would allow for that. So I think that's part of this ongoing conversation, is us working with the department to make sure that we're not duplicating, but better leveraging and providing all available opportunities to have support for our providers, the people who take care of us. Are there further questions or comments? Seeing none, we again are on item 4, Senate Bill number 1450. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Representative Belton, I did not see you on screen, please.
Belton votes yes.
Thank you. Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers, Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Burger Givallo,
Burger Givallo votes yes.
Representative Biggins, Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django, Representative Gilchrist,
Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Senator Hockedal,
Senator Hockedal votes yes.
Senator, I did not see you on screen, please.
I am here. Senator Hockedal votes yes.
Thank you. Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
Representative Mara votes yes.
Representative Martinez, Representative Maureen Bello,
Lauren Bello votes yes.
Representative Parker, Representative Paletto,
Yes.
Senator Rahman, Representative Reddington Hughes,
No.
Representative Ryan,
Representative Ryan votes yes.
Representative Ryan, I did not see you on screen, please.
I can see myself. Representative Ryan votes yes.
Thank you, sir. Senator Slabb,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes, and I can see you, Kevin.
Representative Zupkis.
No to flag.
Thank you. Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 5 on our agenda, Senate Bill number 1507. This is, get ready for the long title, an act prohibiting private equity ownership and control of certain healthcare institutions and the controlling of or interference with the professional judgment and clinical decisions of certain healthcare providers, and requiring an evaluation of the appointment of a receiver to manage hospitals in financial distress. This is a JFS to the floor, LCO 6748. May I have a motion?
So moved.
Moved by Senator Anwar and seconded by Representative Jenga. With this bill, private equity and real estate investment trusts would be unable to either acquire ownership or increase ownership or have operational or financial control of hospital in Connecticut. That is part of our S language. The group practices were removed in the S language, which is the major S language change. It prohibits DPH or DMIS licensed entities or MSOs, managed service organizations, from directing or controlling clinical practices, and it outlines specific examples of what that means. It nullifies non-disclosure agreements regarding prohibited conduct and policies that would now violate, and nullifies policies that would now violate the bill's provisions. And finally, it requires the Office of Health Strategy to examine whether or not the Attorney General should be able to petition the courts to appoint a receiver for a distressed hospital. This bill certainly comes in response to what we've seen here in our state as a result of what's happened with Prospect Medical and the resulting bankruptcies of 3 hospitals in 3 communities, impacting countless other communities surrounding those hospitals. Is there discussion on this item? Senator Anwar.
Thank you so much, Madam Co-Chair. Madam Co-Chair, to your point, I just wanted to add a couple of thoughts. The private equity's assault on healthcare systems, especially hospitals, is a nationwide phenomena. And we have seen it in different phases across different parts of the country. Connecticut is unfortunately a little bit ahead than many of the other sites. We are just behind Massachusetts, though. But we know the way they have taken over hospitals that were financially struggling, and hospitals have been financially struggling across the country. Private equity do come in, and they actually use the asset to be able to get their money, sell the property, lease it back, and then lease it back at a price through real estate investment trusts, and subsequently devalue the property. And they devalue the property to the point that it becomes almost close to becoming unsafe, but does not necessarily touch the unsafe point, but gets close enough to becoming unsafe. And then they leave the area, but their next step is that they help put this entire property and the project on bankruptcy filing, and then they're able to get somebody else to buy, or the taxpayers pay for it. This is what has been happening across various parts of the country. It's our responsibility in the state of Connecticut to figure out a way to prevent this from happening. This has harmed communities. They have not been paying taxes to our state. They have not been paying taxes to the towns where they are, and they are expecting the taxpayers to bail them out. And we are not going to allow them to be here to begin with. And that would be one way to prevent this process to happen again in our state. So this is an important bill. I just think that there are further areas of opportunity to address and fix this, but it's in a place where we should move it out of the committee. And hopefully we would be in a place to improve some of the language further as we have ongoing conversations with many of our other stakeholders who are completely on board with the same vision of protecting every citizen in our state by preventing such abusive entities to harm our citizens. Thank you so much, Madam Co-Chair.
Thank you very much, Mr. Chair. Representative Clara DeStidria.
Thank you, Madam Chair. We've heard time and time again the devastating effects that happen through Prospect. This is just one step of us trying to fix and hopefully prevent it from ever happening again. We all, for the most part, want to have limited regulations and controls, but sometimes you need them. And sometimes they truly do help our residents of the state of Connecticut. And like we said, I want to make sure that nothing like this ever happens again, or we're able to get into it before it gets to the point like it has with Prospect. With that said, Madam Chair, can you just explain quickly in the bill, the MSO portion, how that's affected in this bill here today?
Thank you very much, Representative. The quickly with the MSO, we heard testimony from a number of the group practices who utilize managed service organizations that are not controlling. They provide IT support, back office support, and other supports. As a result of that testimony, the S language removes the prohibition in that portion of the bill and limits it simply to hospitals.
Thank you, Madam Chair, for that succinct explanation.
Thank you, Representative. Senator Gordon.
Thank you, Madam Chair. I'm happy to speak on this. I can go on for hours, but I won't. Certainly I've made it clear that my feeling is under no circumstances should it ever be considered good in any way that private equity has a role, even a small role, in hospital systems. We actually, our problem here pales in comparison to what we've seen in other states. Just take a look at what's happened in Massachusetts with Steward Health. What a disaster. And several hospitals are closed and a number of jobs have failed. But this is an attempt to really say, we really need to make certain we're protecting patient care, keeping these hospitals from becoming, I wouldn't say victims, but it's really the people of Connecticut become the victims and the healthcare employees become the victims. When we have private equity that only cares about profits and doesn't care about patients, get involved with our hospitals. And I think that has been shown. And in fact, Congress's Budget Committee issued a huge bipartisan report that highlights the mess nationally. So I believe this bill does very much get to it. And one other part of the bill that I'm very happy to see, and I appreciate that it's in here, is about these business decisions that get made more and more, overriding professional clinical judgment for the care of people and overriding medical decision-making. And those are absolutely wrong. And more we are seeing that. And it's not a good trend here in Connecticut and in the United States. And the more we can do to be loud and clear that it's patient care over profits, it's patient care over business decisions that really are not benefiting patients, then the better it can be for the people of Connecticut. And I'm glad to see that type of revision in this as well. So I think this is a very strong and good step forward. Separately, when there's a post-mortem done on what happened here in Connecticut, including what went on with several state agencies, we can look into seeing how we can do better. But I'm hopeful that if we can prevent this ever happening with any hospital system in Connecticut, we won't have to face this again. So I'm glad to see this, and I'm hopeful that we can get this through and get this enacted and lessons learned and do things better. Thank you.
Thank you very much, Senator Gordon. The people over profits is certainly a theme that we've heard here in the committee, and we're also practical. We recognize that we have to pay for healthcare. So we're hearing and listening to the testimony that we've heard and trying to move forward with some collective solutions, both in this way and in other ways too, which we will debate shortly. Is there any further comments or questions? Seeing and hearing none? Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Seeing and hearing no objection, item number 5 will be added to our consent calendar. With that, we will move on to item number 6 on our agenda. This is House Bill number 6873, an act strengthening the review of healthcare entity transactions. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Gilchrist. This bill addresses the review of the sale, mergers, affiliation, and transactions that result in what we call a material change to the business or corporate structure of the affiliation between systems. The bill extends and changes what and who needs to be reviewed by the Attorney General's office when there is a material change. I will note before I go on, this material change and this notice and the examination of transactions by the Attorney General is something that already happens. It happens privately and confidentially. This bill changes the circumstances under which that would happen. And it also changes the communication with the Office of Health Strategy, which I'll talk about more in a second. The entities are required to give notice under the bill to the AG when such material change occurs. And this bill requires that that notice is given earlier than the current 30 days to 60 days. It requires notice when there are assets, revenues, or anticipated revenues of $10 million or more, whether that is one time or in transactions over a 5-year period. Those material change transactions include things like corporate mergers, acquiring 20% or more of an entity's assets or operations, change in control over an entity, the formation of entities like MSOs that administer contracts, change in control of an entity's governing body, a real estate or lease agreement involving 20% or more of the entity's assets. This requires no notice with no dollar threshold for impacts to hospital systems governance transfers or transfers that control at least 20% of the assets. For transactions that currently do not require a CON, it does require consultation with the Office of Health Strategy regarding access, quality, and cost. And this is what we talked a little bit about in some of our hearings, where the Attorney General's office is really looking at antitrust and the financial aspect of these transactions. The Office of Health Strategy is looking at the access, cost, and quality of care, so the provision of health care in service areas. The bill will allow the Attorney General to impose conditions and to require an entity to obtain a CON if they are not required to do so. The bill provides the ability for the Attorney General's office and the Office of Health Strategy, again, to communicate with one another and to share their respective expertise to determine if change will ultimately benefit patients in the service area. What this will do is allow these two groups to talk with one another. And again, it will require the kind of notice that was not required in the Prospect situation, to use them as an unfortunate example again. Is there discussion on this item? Senator Anwar.
Thank you so much, Madam Co-Chair. Madam Co-Chair, I wanted to thank the governor for proposing this bill, and also Office of Health Strategies and Attorney General's office for being part of the team with the governor along with the Public Health Committee to address this major challenge. Just to put this in perspective, if we had passed this bill about 2 years ago, and then perhaps even longer for another example, the challenge that we had for radiology in the state of Connecticut, where 30% of the radiologists had to leave the state of Connecticut, would not have happened. And then the 120 physicians that were pushed into joining another through Trinity to be pushed into having a contract with another out-of-state entity, that process would not have happened if this bill was already passed in the manner it did. And then moreover, the other challenges that we have seen with the outside of the radiology, that the fact that the insurance company in the state of Connecticut has the ownership of one of the largest primary care healthcare services. That would not have happened. And that we needed a bill, something like this, way back for that part. But the fact that insurance industry, private equity, some of the others are so focused on trying to be part of the healthcare delivery model is dangerous for the well-being of the patients. So a bill like this helps us review them in a manner where they are going to be much more safer if they're unsafe, then there could be conditions that can be placed on them. So this is a good bill. There may be some areas of opportunity that we can look at to further improve this collaboratively with the proponents. But I'm going to be supportive of this bill, and we're hoping that a bill like this can help us protect even the outpatient setting in some of the cases. So thank you so much, Madam Co-Chair.
Thank you, Senator, for your acknowledgement of the many stakeholders who've been part of this conversation in this committee and beyond, the governor's office, OHS, the attorney general's office, and the providers who have continued to give input, and I know are meeting with many of us as we speak. Representative Clara DeStidria.
Thank you, Madam Chair. I do have a couple questions and maybe a comment or two. We talked about the previous bill, private equity, and we're talking about it again right now. What is our major issue with private equity? What's the problem that we're encountering not in just the country, but here in the state of Connecticut?
Thank you very much for the question. Private equity, for some, is a means and a vehicle to provide innovative care and services, as we heard here from the group practices. For others, I think the primary concern boils down to this. A healthcare institution that's a nonprofit institution, the main mission is the focus and care of patients. A private equity corporation or entity, as I've said here many times, and they are not all created equal, as any for-profit organization is not all created equal. But the bottom line is the bottom line, profit. So the concern, as I believe Senator Gordon expressed well in his remarks on the previous bill, is when that motivation becomes in conflict with one another. So when the profit motivation is number one, and then the patient care becomes subservient to that profit motivation. That's what we saw happen in Connecticut, which is when the private equity company stripped our hospital systems of their assets to pay those shareholders to whom they have a fiduciary responsibility, and did that leaving our systems at risk. So that's the fundamental issue. I think we also struggle with the fact that how do we pay for healthcare? We pay for healthcare with public dollars, we pay for healthcare with private dollars, or we pay for healthcare with some combination of the two, and there is no other choice. So we're left with, as we struggle, again, referencing Senator Gordon's comments, with uncertainty in the face of significant federal dollars that we receive, 6.6 billion for Medicaid alone, but also with our own limitations here in the state. How do we balance that? I think that's one of the things this bill does, is say, well, this bill doesn't ban private equity, but it says if we're going to have these kinds of investments in our healthcare, then we need to have guardrails, and we need to make sure that we have transparency and the ability to act when there are issues that we think could be a problem for our patients.
Madam Chair, thank you for that explanation. And as far as my next question, and you did explain we need guardrails, and we need guardrails for a lot of things. So why don't we have the guardrail in this bill of venture capital lists?
That's an excellent question. My understanding is that the language in this bill, and I just learned this today, this portion was actually modeled off of the Massachusetts legislation that passed earlier this year. One of the conversations I had just yesterday with someone who is familiar much more so with financing than I am, venture capital is often used in the early stages of development of companies. And so those initial investments, whereas most private equity work is more in the merger and acquisition phase, I think we are certainly open to having that conversation, but I believe that the exclusion was specifically not to stifle some of those beginning stage investments in those startups that can help to perhaps move things forward. But it's certainly, as is everything in this bill, open to conversation going forward.
Thank you, Madam Chair, for that explanation. I truly believe that by excluding them, this could possibly be helping a certain population or maybe a person in our state, and I certainly wouldn't want to see that happen. Madam Chair, with that said, I would like to amend this bill to strike lines 110 through 112. That states private equity entity does not include a venture capital firm exclusively funding a startup company or any other early stage business. And I'm sorry, Madam Chair, and I'd like it to be taken by roll.
So the amendment before us,
Like to
there's
move
a
it as a
motion
text
has been made to amend the bill, to amend LCO. Nope, it's the JF, to amend the bill to remove lines 110 through 112. Private equity entity does not include a venture capital firm exclusively funding a startup company or any other early stage business. Is there a second? Seconded by Representative Zupkis. So discussion on the item. I'll go to you, Senator Anwar.
Thank you so much. I just wanted to clarify this a little bit. In our, and this is asking from the proponent of the amendment, all venture capitalists are not necessarily private equity. And if there is innovation in healthcare, and if they are, if a venture capitalist company or a group is interested to, let's say, looking at new computer technology to try and make healthcare more efficient, if we were to pass the amendment, would that restrict them from being able to innovate treatment and management?
Thank you, Mr. Chair. I think this is another one of those tools in the toolbox. We want to make sure that someone doesn't come in as a venture capitalist and then adding private equity as part of it. So I think with striking this section, we don't want to have an unintended consequence of a loophole. And then we're coming back next year and trying to change it because now we see someone coming in that has private equity backing that's doing a startup that wants to do a new mechanical face mask for a CPAP machine. And they come in and they're a startup, which is great, but then they end up having some private equity as backing. So I think I don't want to come back next year and fix this. I'd like to address it right now if at all possible.
Thank you for that answer. So I'm going to try to see if I can understand this right. We are talking about ownership, and the ownership of private equity is very clear that we do not want that, because I think that's where everybody would align, that we do not want private equity ownership and governance or control of the clinical care. I think that part is very well spelled out in this bill in its current form. The venture capitalist part exclusion, my understanding is that Massachusetts did for the reason that I think Connecticut should consider as well, because there's a lot of new technology, medications, various things that are happening, which would not make the venture capitalists own the company, but be involved in healthcare, so that if there is a new product that they would be able to use the clinical settings to be able to prove the concept and be able to create innovation. And we don't want to restrict innovation. So I think that's the rationale, because Massachusetts, part of Massachusetts is a hub for healthcare innovation. So I think that's the door that should not necessarily be closed. But if venture capitalists become private equity, then the bill would still be there to be able to protect us from their activities or trying to control that. So that's how I'm seeing this. I'd rather not have the innovation opportunities in healthcare be removed because of a concern where the venture capital company can become a private equity. And if that happens, then the bill is right there to be able to protect us from that. So thank you. Back to you.
Thank you very much, Mr. Chair. And I will add a couple things. The bill does not exclude venture capital from exclusively. And I think this is a pretty technical bill, and I will say I'm still learning as I go. But one of the things that I did was reach out to someone who works in finance. And part of what was shared with me is venture capital pretty much primarily only invests, as Senator Anwar was saying, in emerging companies from early stage to growth. And traditionally, private equity invests in the established companies for growth, mergers and acquisitions, and LBO, please don't ask me what that stands for, going from public to private. So those strategies tend to fall within that kind of that middle market piece. I think the concern, and this is why I said, ongoing conversation is welcome, is that what we don't want to have happen is whether it's whatever kind of capital it is, venture capital, whatever, private equity, that any of those, that we're making sure that we have eyes on them. I'm not going to be able to cite you the line here where it is, but it's my understanding that that the bill would still do that it's excluding for that early stage investment period, not for later down the road. After having conversation previously with others, my thought was to leave this in for now, recognizing that we are going to need to have more conversation about this. No one here at this committee, I believe, would like to see any kind of potential conflict occurring. I think what we want to make sure, and this is what we've been talking about as we did under the last bill, that we are putting eyes on absolutely everything we need to provide those safeguards. So for now, I'm asking to oppose the amendment, but I will very much be interested in further conversation to make sure that we have the safeguards we need. Representative Clara DeStitrio.
Thank you, Madam Chair. And to respond to Senator Anwar's question or comment about innovation, this isn't about innovation. It's about mergers and acquisitions, and venture capital can do that. And that's what we're trying to prevent any issues with that. So I encourage all my fellow legislators to please vote for this amendment, because this is something that does not belong in this bill. And for that matter, I don't believe it wasn't excluded in the previous bill in 1507. So thank you, Madam Chair.
Thank you. I will point to the language that is in the line 110 to 112. This is to include a venture capital firm exclusively funding a startup or any other early stage business. So that's the only exclusion is for the startup or early stage business. It is not for further stage business, just to clarify that for folks. Is there any further discussion? Senator Marks.
Thank you, Madam Chair. To the proponent of the amendment, you said in the beginning that you believe this was to protect someone, or I really didn't understand what you were saying. If you could elaborate on that and maybe give an example of why you think that this amendment is needed. I'm having a hard time understanding where you're going with this amendment.
Thank you, Madam Chair. Yes, Senator, I made the comment because we do have venture capitalists in the state of Connecticut, and I'm singling out people that may own those businesses to make sure, to make my point, that we're not creating a loophole again for anybody to come into Connecticut and hurt our healthcare system, which is something I know we're very passionate about protecting. And we know that venture capital can own things. So I think with the merger and acquisition point, I think that's a really important point to make to support this amendment. I hope that answers your question, Senator. Thank you, Madam Chair.
Thank you, Representative. Senator Marks, any further questions?
No, thank you, Madam Chair.
Thank you. And I will also point out that the venture capital piece would not require or cause an automatic trigger, but the venture capital piece would still fall under this bill if we get to that $10 million threshold, if they purchased a substantial stake. So it actually would be caught under that other portion of the bill. So basically, the venture capital alone in those early stage, where it says here, the exclusive funding of a startup or early stage business, that's not an automatic trigger. But if that venture capital bought a substantial stake in the business and they met that $10 million threshold that's in the bill, that would be captured. The venture capital would then be captured in the review process that way, but it just wouldn't be automatically.
Okay, then back to my point, then they shouldn't exclude it. We should still keep it in there. Because as you said, venture capitalists they can own things, and a venture capital firm can come in and purchase a healthcare practice. I encourage my fellow colleagues to vote for this amendment. Thank you, Madam Chair.
Thank you very much, Representative. One way or another, we will be discussing this further, I'm sure. Seeing and hearing no other questions or comments, Madam Administrator, would you kindly call the roll on the amendment, which is to remove lines 110 through 112, and the words private equity entity does not include a venture capital firm exclusively funding a startup company or any other early stage business.
Senator Anwar,
Senator Anwar votes no.
Representative McCarthy Vahey,
McCarthy Vahey votes no.
Representative Belton,
Belton votes no.
Representative Belton, I did not see you on screen, please.
Belton votes no.
Thank you. Senator Marks,
Marks votes no.
Senator McCory, Senator Summers, Representative Clarice Dietrich,
Clarice Dietrich votes yes.
Representative Berger Givallo,
Berger Givallo votes no.
Representative Biggins, Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Rep. Dauphiné votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott,
Elliott, no.
Representative Django,
Yes. No.
Representative Gilchrist,
Gilchrist votes no.
Senator Gordon,
Senator Gordon votes yes.
Senator Huckadell,
Senator Hockedal votes no.
Representative Cavros DeGraw,
Cavros DeGraw votes no. Cavros DeGraw votes no.
thank you. Representative Kitt,
Representative Kitt votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Unknown caller.
Representative Morrow,
Mara votes yes.
Representative Martinez,
Representative Martinez votes no.
Representative Morin Bello,
Morin Bello votes no.
Representative Parker,
Representative Parker votes no.
Representative Paletta,
Rep. Paletta votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Representative Ryan votes yes. Sorry, votes no, votes no.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Supkis,
Yes.
Madam Administrator, I believe there are a few people who are online now who might not have voted.
Yes, please.
Senator McCory, Senator Summers, Representative Biggins,
Representative Biggins votes no.
Senator Kushner, Senator Rahman, thank you, Madam Chair. Just a minute.
Senator Rahman has entered the Zoom room. I don't know if he heard you.
Yes, I'm here.
Senator Rahman,
Yes.
how would you like to vote?
So what is this? Is the amendment?
We're voting on the amendment.
No.
Thank you.
Senator Rahman, we need to see you before you can vote.
Of course.
Senator Rahman,
It's the amendment. Say no.
thank you.
You're welcome.
Madam Chair, are you ready?
Yes, Madam Administrator, if you would kindly announce the tally.
Total voting 29, those voting nay 20, those voting yea 9.
Thank you, Madam Administrator. Though the amendment fails, the conversation on this issue will continue as we move forward on this bill. Is there further discussion on the bill? Senator Gordon.
Thank you, Madam Chair. I understand the intent of this, and in general, I do support what this is trying to get at. I do have concerns. I think that in some situations, this is casting such a broad net, kind of in a sense, a reaction to what's gone on and what may have been lack of action by some state agencies previously when we were dealing with private equity, that I'm concerned about the impact on the small private practices. We should be doing what we can to try to help them. They're the ones really struggling. And when we have reporting, which we have now, and then when we add more layers on top of what they have to report, more reviews, without in this bill, and I've raised this in other meetings, with what is really the consistent criteria to be used, we're giving more authority and responsibility to the Office of Health Strategy, to the Attorney General's office. I'm just not certain where that specificity really is. And it raises a concern, especially for the small private practices, that what more hoops do they have to jump through that they may decide they just don't have the bandwidth or the finances to do and can just close up shop and leave. We're losing a number of them already, and some of that is feeding into the consolidation, which is a whole separate issue here, of healthcare. So I'm just concerned enough with the lack of a lot of specificity with what the Attorney General's office could do and with what the Office of Health Strategy could do in this bill, that I would raise those as concerns. And so regardless of how I vote, I just want to raise those to see what more we can do working on some of that. I think, again, I understand the intent of it. I just have concerns enough to flag some of these items that we really need to drill down into that. We shouldn't be doing a big funnel and trying to capture the entire sea and then see what comes out at the bottom. And so I just have a concern about that. Thank you, Madam Chair.
Thank you very much, Senator Gordon. I think one of the things that this is not directed to you, I think just generally speaking is widely misunderstood is that the current practice for the notice of material change with the Attorney General's office. Again, as I mentioned before, because that is a private and confidential process. But to your point, this bill will certainly be one of the bills that we will continue to have conversations on work in partnership. Even first thing this morning and earlier today, had some conversations to start the day. I know that there were meetings held this week to try and address actually, I think, some of the issues that you are bringing up related to this. So I look forward to further conversation and working together as chairs and ranking members with our stakeholders. Other comments or questions on this item before us? Seeing and hearing none, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks, Senator
Marks votes
McCory.
yes.
Thank you. Senator McCory, Senator Summers, Representative Clarice D.
No.
Representative Burger Givallo,
Burger Javala votes yes.
Representative Biggins, Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Rep. D'Amico,
D'Amico votes yes.
Rep. Elliott, Representative Django,
Yes.
Representative Gilchrist,
Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Senator Hockenell,
Senator Hockenell votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Yes.
Representative Parker, Representative Paletto,
No.
Senator Rahman,
Senator Rahman, yes.
Representative Reddington Hughes,
No, thanks.
Representative Ryan,
Votes yes.
Senator Slapp,
Senator Slapp is a yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. The votes will be held open until 4:30 today. So we've settled on 4:30 at this point. Okay, moving on to item number 7 on our agenda, House Bill number 7157. This is a perennial favorite, an act concerning various revisions to the public health statutes. This is a JFS to the floor, LCO 6773. And is there a motion? Moved by Representative Gilchrist and seconded by Representative Jenga. Thank you, representatives. This bill has 11 different items, so bear with me. I'm going to go through them, and then I will go through what the S language does. The bill requires no fee for family members to obtain the death certificate of a minor child. The bill allows EMS to use the nasal spray version of epinephrine, which is now approved by the FDA. It requires physical therapists to do 2 hours of ethics training as part of their regular continuing education. It prohibits healthcare providers from requiring a credit card or bank information as a condition of care. Many sections of the bill, sections 5 to 17 and section 24, update the confidentiality protections for psychologists so they align with other behavioral health providers. The bill also increases the maximum civil penalty of providers from $10,000 back to $25,000 where it had been previously. We made that change last year when we added the institutional fine of 25,000. Sections 19 and 21 change statutory reporting dates, both for workplace violence incidents and the nurse staffing compliance reports. The bill also allows MRI and rad techs, radiologic technologists. I've been with that group a little too long. I'm starting to do code speak, to perform certain oxygen-related patient care. In Section 2, it specifies that when a hospital has a Department of Public Health license, it does not need to get an additional DCF license to provide mental health services and receive available funding through the DCF Outpatient Psychiatric Clinic Program. And finally, the bill creates a new short form death certificate that would not include the cause of death. This does not eliminate any portion of the current long form death certificate. And let me go through what the S language changes were. Those changes were the changes in the reporting date, the oxygen-related care, the DCF outpatient psychiatric clinic program and licensure, the short form death certificates, and with respect to filing of credit card information or bank information, the bill makes clear that patients are still required to pay their bills, one, and two, if a patient voluntarily provides that information to their healthcare provider, that provider may keep that information on file. Is there discussion on the item? Representative Clara DeStitria.
Thank you, Madam Chair. Thank you for the explanation of each section. I'm glad to see that we finally have Representative Lanou's short form request that he's been advocating for quite some time. And my one question, under the civil penalties, we're increasing it. Can you just explain to us, last year, we moved it down to 10,000 per request. This year, we're moving it back up. But they did mention to us that they've never imposed the maximum $25,000 penalty. So if you could just give us an explanation on that, please. Thank you, Madam Chair.
Thank you very much for that question and the chance to speak to that. And I'm having a brain freeze on the name of the board who came to us. And at the end of last year, when we were negotiating a bill, we agreed, as I mentioned, to add a civil penalty provision for institutions, which there had not been. When we did that, and that was at 25,000, and the individual provider penalty was also at 25,000. So in that negotiation, we agreed to lower it to 25,000. We did so without consulting with the board, who then came back to us, largely volunteers, and asked that they have the ability to leverage such fines and penalties in the case of egregious examples. They did, as you have noted, Representative, acknowledge that they do not, pretty much don't do such a maximum penalty, but they feel that they are in, yes, thank you very much. The Medical Examining Board. I love this team effort. Thank you, Representative. Yes, the Medical Examining Board felt that this was one of the tools that they would like to have in their toolbox, despite the fact that they rarely use it. They take it very seriously. So this provision in the bill is in the bill at their request. Is there further discussion? Senator Anwar, to be followed by Senator Gordon.
Thank you so much, Madam Chair. Madam Chair, I just wanted to recognize that this medical board, examiners board, they have been volunteers and put in hundreds of hours as volunteers looking at many of these cases, making sure that the clinicians providing care in our state are safe. Just wanted to take this opportunity, since this bill is being considered, or the adjustment is being considered, I wanted to thank them for their volunteer work for so many years, and we thank you. And your efforts have reduced the risk of poor quality care in our state. Thank you so much, Madam Chair.
Thank you. I would concur with those thanks. Senator Gordon.
Thank you, Madam Chair, and I appreciate the call out to those who serve on the medical examining boards. I did for a number of years. Only reason I left it was I became I think at the time, the vice president of the State Medical Society. So I couldn't legally continue on, but they do good work in sometimes very difficult circumstances of some of the cases. I do just wanted to call out that I do like the fact that there's been some recognition in Section 4 where it talks about providing credit card information, things like that. I just want to make certain that people, especially the public, understands, because I see this all the time in my practice when they get upset about what their deductibles are. This is not at all healthcare professionals setting these deductibles, especially in an era of high deductible health plans. This has become more and more, this is the purview of what health insurers set for deductibles, the decisions they make, and then they sometimes, many times, have to leave it up to health professionals to collect the money that really is up to the health plans to be doing that, but they like the fact that they can have somebody else do it. So I just wanted to make certain that that's clear in there, that this is not trying to get after the healthcare professionals. They certainly want to provide the care, but there is wording in there that says that that Section 4, nothing's going to affect someone's obligation to pay. But again, we're seeing more and more people having to pay more and more, and any anger out there about that should be directed to the health insurances, not to anybody who's a healthcare professional. Thank you.
Thank you for that, Senator Gordon. I'm glad that we were able to have language that specified that, because certainly we want our healthcare providers to be able to be paid for services rendered. We had heard testimony where there were folks unable to get care without putting this on file. So I think this is a good compromise. Representative Kennedy.
I apologize, Madam Chair. I don't want to dwell on it. I just want to be clear on this, because we did reduce this just a year ago. But did you say, or maybe the good senator did, that no one's ever been charged the full amount? So is it a sliding scale? Am I understanding that to be correct? How does that exactly work?
Thank you for the question. I would never say never, as my mother taught me, because I don't have that data point. What we have heard from them is their average fine is much lower than 25,000. And it is, and certainly Senator Gordon is free to answer as well, but it is a case-by-case determination based on the severity of the circumstances. And unfortunately, in rare circumstances, when we have providers who have committed an act that is particularly egregious, that is the reason that they've asked us for the ability to have that, though they don't anticipate making regular use. In fact, we would like to see the medical examining board not have to do any work. Wouldn't that be great?
Thank you for the further clarification. Thank you, Madam Chair.
Thank you. Seeing and hearing no other discussion on the item, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to our consent calendar.
Seeing and hearing no objection, item number 7 will be added to our consent calendar. That's House Bill number 7157. And with that, I believe we have come to our consent calendar, which has been properly moved and seconded. Our consent calendar includes item number 2, Senate Bill 1331, an act concerning the exclusion of patient health information and opt-in and opt-out procedures relating to the statewide health information exchange. Item number 3, Senate Bill 13, and excuse me, that was LCO 6745. Item number 3, Senate Bill 1395, an act establishing licensure for long-term acute care hospitals and requiring the Department of Public Health to study the designation of long-term care facilities and chronic disease hospitals. That's a JF to the floor. Item number 5, Senate Bill number 1507, an act prohibiting private equity ownership and control of certain healthcare institutions and the controlling or interference with the professional judgment and clinical decisions of certain healthcare providers, and requiring an evaluation of the appointment of a receiver to manage hospitals in financial distress. This is a JFS to the floor, LCO 6748. And finally, item number 7, House Bill number 7157, an act concerning various revisions to the public health statutes. It's a JFS, LCO 6773. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory, Senator Summers, Representative Clara DeStitria,
Yes.
Representative Berger-Givallo,
Senator Ravala votes yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Senator Hockenell,
Senator Hockenell votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kidd,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Morrow,
He's letting you in right now, okay? Yeah, he says he's gonna.
Representative Martinez,
Representative Martinez votes yes.
Representative Maureen Bello,
Yes.
Representative Parker,
Representative Parker votes yes.
Representative Paletto,
Yes.
Senator Rahman, Representative
Yes.
Reddington Hughes.
Yes.
Thank you, Senator.
Reddington
Representative
votes
Reddington
yes.
Hughes. Thank
Yes.
you. Representative Ryan,
Votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis,
Yes.
Senator McCory, Senator Summers, Representative Elliott, Senator Kushner, Representative Morrow. Thank you, Madam Chair.
Thank you very much, Madam Administrator, to you and all behind the scenes, as always. Votes will be held open until 4:30. Just for folks, a reminder, next week will be a busy public health week. We have a public hearing on Monday and 2 committee meetings next Wednesday, 11:30, and Friday at 1:30. And with that, we wish you a wonderful weekend. Thank you, everyone. We're in recess.
Madam Administrator. Hi, Peter. Can I catch up on some votes?
Test, test. Okay, you can hear me?
I can hear you. A little bit of an echo, but I can hear you.
Yeah, it's the room, sorry. Okay. Sorry for that, guys.
That's okay. No worries.
So first on our agenda was SB 1285, and that was a roll call. How do you
Yes,
like to vote?
please.
Okay.
Biggins votes yes.
Item number 4, SB number 1450 was a roll call. How do you like to vote?
Yes.
And then item number 6, HB number 6873 was on our roll call. How do you like to vote?
Yes.
And then item 2, 3, 5, and 7 were on our consent calendar. How do you like to vote on our consent calendar?
I think I caught that
You
one, but
voted
yeah.
yes already, Peter.
Oh, okay.
Thanks, Bev.
You're welcome.
That's good.
Yeah, I have you everything.
Thank you very much. Have a good one.
I think I missed the first couple votes.
So our first item was.
Are you going to take the votes, Peter?
Yeah, or do you want me to come up there?
Go ahead and take it.
Okay. So our first item, SB 1285, was a roll call. How do you like to vote?
Hockenell votes yes, please.
Okay. The next item that was a roll call was item number 4, SB number 1450. How do you like to vote?
Hockenell votes yes, please.
Can I do that? I have you for that one. And I have you for, let me just make sure you can consent calendar.
Yeah.
Yeah, I'm good.
You're all set.
Thank you. Have a great weekend.
You too.
Did I miss anything though?
Oh, I have you for that one. I'm missing you for item number 4, SB number 1450.
1450, that's not amend, oh, what is that?
An act concerning recruitment and retention.
Okay, okay, so I think the chair supporting this bill, am I right?
Yeah.
Sure, yes.
Okay.
Good, all set?
Let me just make sure. That one. Here for that one, and I have you on the consent calendar. Yeah, you're all set. No
Awesome, thank you.
problem.
You take easy.
You do.
Hello.
Okay. So I'm missing you for item number 1, SB 1285. How do you like to vote?
Yes.
I'm missing you for item number 4, SB number 1450. How do you like to vote?
Yes.
I'm missing you for item number 6, HB number 6873. How do you like to vote? As a roll call.
Yes.
And then I believe I have you for the consent calendar. Yep, okay, you're all set.
Thank you so much, Peter.
Yeah, have a good one.
Yeah.
Yeah.
No.
Hello.
Hello.
Okay. So, are you ready?
Yes.
Yep.
Okay. So item number one, SB 1285 was a roll call. How do you like to vote?
Yes.
And then item number four, SB number 1450 was a roll call. How do you like to vote?
Yes.
And then item number six, HB number 6873 was a roll call. How do you like to vote?
Do I need to say Senator Kushner votes yes,
No,
or
you
you
can
got
say
it?
yes.
Okay.
Yeah.
Yes.
And then items number 2, 3, 5, and 7 were on the consent calendar. How do you like to vote on the consent calendar?
Yes.
Okay, you're all set. I got you.
Thank you, Peter.
Yeah, have a good one.
Good night.
Mhm. Hold
Hey there, young man.
on. Hey, all right. Are you
Hello.
ready? Oh,
Ye-
can you hear me?
Yeah.
Okay, I can hear you. All right.
Yep. How many bills we got?
You have 7.
Yes.
Okay.
What's the first one?
So the first one is SB 1285, an act establishing an overdose prevention center pilot program. How'd you like to vote?
Yes. Yes.
Mhm.
Yes.
The next item on our agenda was item number 2, but that was on the consent calendar. Item number 3 was put on the consent calendar.
Okay.
Item number 4 was a roll call, SB number 1450. How'd you like to vote?
Yes.
And then item number 5 was put on the consent calendar. Item number 6, HB
Yes.
number
Okay.
6873 was on the roll call. How'd you like to vote?
Yes.
And then item number 7 was on the consent calendar. So how would you like to vote on the consent calendar?
Item number 7 was on good. Yes.
Consent, yeah. Okay. All right, you're all good. I have you for the consent calendar and the other bills.
Okay. Thank you.
Yeah, bye.
All right. Bye.
Oh,
How's it going?
hey, okay. So I'm missing you for item number 1 on the agenda was a roll call, SB 1285. How'd you like to vote?
Yes.
And then item number 4 was a roll call, SB number 1450. How'd you like to vote?
Yes.
And then item number, item number 6, HB number 6873 was a roll call. How'd you like to vote?
Yes.
And then items 2, 3, 5, and 7 were put on the consent calendar. How'd you like to vote on the consent calendar?
Yes.
Okay, you're all set.
Thank you.
Yeah, have a good one. Hi, can you hear me?
Hi, sorry about that. I think I clicked next week's meeting, so that certainly didn't help.
That's all right. Are you ready?
Yes,
Okay. Item number 1 on the agenda, SB 1285 was a roll call. How'd you like to vote?
yes,
Item number 4, SB number 1450 was a roll call. How'd you like to vote? Oh, wait, no, I have you for
Ye-
that one. Yeah, I have you as a yes. Is that correct?
yes.
And then I have you. And then I'm just missing you for the consent calendar. So items number 2, 3, 5, and 7 were on the consent calendar. How'd you like to vote on the consent calendar?
Yes.
Okay. Yep, you're all set.
All right. Thank you so much.
Have a good one.
You too. Bye.
Hi, I'm just here to vote.
Okay, yeah. So, number one, SB 1285 was a roll call. How do you like to vote?
Can you give me the title of the bill, please?
Yes. An act
Sorry.
establishing an overdose prevention center pilot program.
No.
Okay. And then item number 4, SB number 1450, an act concerning recruitment and retention of the healthcare workforce was a roll call. How do you like to vote?
Yes.
And then item number 6, HB number 6873, an act strengthening the review of healthcare entity transactions was a roll call. How do you like to vote?
Yes.
And then items number 2, 3, 5, and 7 were on the consent calendar. How would you like to vote on the consent calendar?
Yes.
Okay, you're all good.
All right, thank you.
Yeah.
And that's it.
Hello?
This public health, right?
Yeah, public health, yeah.
I thought I did this already, right?
Yeah, you did this already. Yeah, I got you.
All
covered.
right.
You're all good.
All right. Bye-bye.
Yeah.